So this presentation will be looking at anterior cruciate ligament injuries. Now, these are often a traumatic injury and may involve a full thickness tear of the anterior cruciate ligament. At the time of injury, often people will experience an effusion of the knee, and this is due to blood and bleeding into the knee joint from the torn ligament. This is described as a hemarthrosis. The mechanism of injury by which this occurs is often a non-contact twisting injury when the individual is performing a cut and plant maneuver. When the ACL is ruptured, there may well be other injuries that occur within the knee joint. Most commonly, it is the lateral meniscus that is injured at the time. However, it can be in combination with other injuries, such as an unhappy triad, in which case you get an ACL rupture with a medial collateral ligament rupture and a medial meniscal tear as well. So it's important to bear all of this in mind when you're seeing a patient who you suspect has an ACL tear. Now, the symptoms that people describe varies from when it happens initially to the more long-term problems that they experience. At the time of injury, the individual is likely to have quite a significant amount of pain in their knee and also the effusion or hemarthrosis that we previously described. Sometimes individuals describe a popping sound in their knee, and also they're highly unlikely to be able to continue with their activity. And these are important points in history to elicit when you are seeing these patients. Now, the main thing that determines what we are going to do for these patients is whether or not they have any instability. And again, it's important to get this out from the patient by asking them if they're experiencing their knees giving way, if they've had to stop doing certain activities, and or if they find it difficult walking on uneven ground. Once you've taken your history, then obviously the next phase is an examination. And again, this will be different when you see the patient in the acute phase, i.e. very close to the time of injury, to when you see them later. When the knee is injured initially, then it can appear very swollen and warm and very tender. Patients may experience problems with range of motion, but doing any special tests can be extremely difficult in the patient due to this pain. However, as their symptoms settle, then you can do some of the more special tests. Now, the special tests that we do to assess for an ACL rupture are the Lachman's test, the anterior draw test, and the pivot shift test. And whenever you're examining the patient's knee, you should also examine the contralateral knee to ensure that what you are finding is not normal for the patient. Once you've taken your history and your examination, then obviously we move on to our investigations. Now, imaging will always help guide our management, and in the acute phase, an X-ray of the knee can be useful as this can give us information about any other injuries to the bone that may be causing the knee swelling that the patient is experiencing and help us to rule that out. However, the most important investigation that is required in order to diagnose whether or not there is an ACL rupture is an MRI scan, as this will give us the necessary information about the soft tissues within the knee. With the MRI scan, we will also be able to pick up other injuries to other structures within the knee that can occur in combination with it. Management of the ACL injury is highly individualized and dependent upon the patient, their symptoms, and what their expectations and hopes are regarding their activities in the future, as well as any other injuries that they may have sustained at the time of their ACL injury. Now, management can be divided into non-operative and operative. Non-operative treatment is by way of physiotherapy and activity modification. The reason patients have to modify their activities is because they're highly unlikely to be able to participate in anything that involves any pivoting, and they may well have to change their hobbies or what they like to do. If patients decide to go down the operative route, then we can perform an ACL reconstruction, and this can be performed using either their own hamstrings tendon from that leg or using some of their patella tendon and bone to reconstruct their ACL, and this procedure is often done arthroscopically.